evening, everyone. We begin with that steep increase in North Carolina's response to COVID-19.
Yeah, the governor now calling for a stay-at-home order across the entire state. This takes effect Monday starting at 5 o'clock. And it comes after new findings from the CDC that 20 to 30% of the people diagnosed with COVID-19 in the last month have had to be hospitalized. I want to bring in Channel 9's Allison Lottis live right now. Allison, to go over these breaking developments at the state level, just those of you that are just now joining us. Allison, bring us up to speed.
So the Governor Roy Cooper, just announced today that starting on Monday at 5 o'clock, there's going to be a statewide stay-at-home order that's going to kick in at 5 p.m. on Monday and last all the way to April 29th, really saying that this pandemic, this crisis across the country is a matter of life or death. And health officials saying that we do not have the luxury of time. In addition to ordering people to stay home, the governor is banning gatherings now with more than 10 people. Even though this starts on Monday, he's really encouraging people to begin practicing this now and really encouraging social distancing. This is supposed to last 30 days, but honestly, I wouldn't be surprised if we continue to reassess the situation. There is a potential it could be shortened, it could be extended. We don't know. We'll have to see how it goes. The governor has also really stressed the fact that we have widespread transmission across the state now, meaning we have so many people who are getting COVID-19 and don't know how they contracted the virus.
Well, Allison, a quick question for you. The governor briefly touched on what you can and can't do under this order. Can you go a little bit more in detail?
Sure, it really boils down to those essential tasks like, do you have a job that's considered essential? Or if you're going out to the grocery store, you need to buy food, you have a doctor's appointment, or you have to go to the pharmacy. You can go outside to exercise. Those are some of the things you are allowed to do. It's about 10 pages long, this order, so I'll be going through it over the next hour to really map it all out for you. But it looks very similar to what we already have in effect here in Mecklenburg County. And the governor did say that if people are violating this, if they are purposely going against this order, they can be charged by police, and that would be a misdemeanor.
And Allison, you just mentioned Mecklenburg County already under a similar order, as well as Cabarrus and Gaston counties too. What effect does this have on those orders?
So really, the governor said whichever order is the most strict is sort of going to supersede. Right now, Mecklenburg County's is in effect, but as you heard Joe Bruno mention a few moments ago, that order was only supposed to last until April 15th. The governor's order is longer, so obviously that will stretch and fill in that gap. So really, it's going to depend on which has the more strict rules, if it's local or state, and whichever one does will be the one that supersedes. And in Mecklenburg County, after a full day of the stay-at-home order in effect now, police say they're really pleased so far with how this is going. Parks and greenways and boat ramps are still open, so you are allowed to get outside. It's been a beautiful day today, but it is important to really take this seriously because community spread is getting worse. It now accounts for more than half of the 259 cases in the county. CMPD did say that they're investigating 1,200 complaints about the stay-at-home violations, and they're working through those one at a time. North Carolina has 763 cases statewide, and there have now been 3 deaths. Also in the past half hour, South Carolina Governor Henry McMaster issued a mandatory quarantine for people who are coming into South Carolina from some of those designated hotspots. So that means anyone who is about to visit South Carolina from New York, New Jersey, Connecticut, and New Orleans, those places that have been dubbed hotspots, they have to quarantine for 14 days. And that also can come with some criminal consequences. The governor said 30 days in jail and a $1,000 fine. 4 more people have died in the state of South Carolina because of COVID-19. It's now a total of 13. There are 539 cases statewide, and York County has the most in our area at 18 cases right now. Both governors reiterated today, do not gather in groups of more than 10 people because someone could have the coronavirus and not know it, be one of those asymptomatic people who feel fine but are spreading it. And that's just something that we absolutely have to take seriously.
Absolutely right. Allison Lanos reporting live for us tonight. We'll check back in with you in a few moments. Thank you.
American Airlines flight attendants are now sharing their concerns after one of their coworkers tested positive for coronavirus and then died. That flight attendant was based out of Philadelphia.
Well, the flight attendants we spoke to worry that the airline is failing to protect them and passengers.
Channel 9's Tina Terry took those concerns to airline officials today.
Now, those American flight attendants told me they are very concerned about what they've seen on planes. They say it would be best if American stops all flights for a couple of weeks to keep both the public and employees safe. We didn't see much activity at Charlotte's airport today, and 2 flight attendants for American say flights should stop altogether. They told me conditions for them and passengers have been unsafe.
They're out there completely out of hand, the sanitizing wipes, like the Clorox wipes that we get on board. So we have nothing to clean surfaces with.
Both flight attendants told me it wasn't until this week that the airline limited food and drink service to passengers and allowed them to wear gloves and face masks. Changes, they say, come too late after they've already been exposed. In a statement to Channel 9, one attendant said, "I'm scared to bring something home to my family. I can't afford to stay at a hotel to distance from them after trips."
I have spoken to at least 6 flight attendants who told me that they have the signs and the symptoms but cannot afford to either go to the doctor, or they cannot afford to lose their job, or they cannot afford to take time off. So maybe they're out there flying with the coronavirus.
Today, American Airlines announced a decision to reduce its schedule due to reduced customer demand. A spokesperson said wearing face masks and gloves isn't recommended by the CDC, but they relaxed the rules to help flight attendants. And regarding cleaning supplies, they said though these items are in high demand, we're currently provisioning these necessary products to our flight attendants for use while flying. But workers say halting service for a few weeks is the only option to keep employees and the public safe. According to American Airlines, that Philadelphia flight attendant who contracted COVID-19 and died was over 65 years old, and they say that he had health issues that made him susceptible to complications from COVID-19. Back to you at the desk.
Tina Terry reporting for us. Thank you, Tina. Well, American Airlines said that their hearts go out to that flight attendant's loved ones. They also said employees with health issues and most mainline team members can consider a voluntary leave during this time or a company voluntary early out option.
In the last half hour, President Trump signed a bill to give struggling families a potential lifeline. The $2.2 trillion stimulus package that just passed should put money in your pocket almost right away, but a lot of people still have questions.
So with that, let's turn right now to Action 9 investigator Jason Stujinku, who's live in Cotswold. And Jason, you spent all day getting answers for people.
Yeah, that's right. This is really good because we know so much more now than we did just a few hours ago. So keep the questions coming, and here are the answers to the most common ones. The first question, how much will you get? Let's start with singles. If you make up to $75,000, you'll get $1,200. If you make between $75,000 and $99,000, you'll get gradually less. If you make over $99,000, you won't get anything. Now, married couples, if they make up to $150,000, they get $2,400 plus $500 per child. If they make $150,000 to $198,000, they get gradually less. And if they make more than $198,000, most won't get anything.
I mean, the $1,200 check, I know that people qualify for that. And just knowing that that's coming is a huge relief.
The second question, do you have to pay taxes on it? No. Third, what if you're on Social Security, on disability, or are unemployed? Yes, you should get money too. Fourth, what's your amount based on? Well, your 2019 tax return. If you didn't do it yet, it's based on your 2018 one. If you didn't file taxes either year, go ahead and file something now, or you may not get the money. Fifth, many people will also get extra unemployment money. In most cases, an extra $600 each week for 4 months on top of your state benefits. And yes, that includes people who are self-employed, like Sherry Lynn Bishop.
As soon as I came across the TV, I was like, oh my God, please, thank you. Like, it was a huge relief.
And of course, another big question, when will you get the money? Well, President Trump said something about April 6th, but a lot of experts agree that may be optimistic. It sounds like you should expect the money maybe more like mid-April. Damani?
Well, Jason, there are a lot of people with student loans. So what does it mean for them as well?
Yeah, good news for them. They don't have to pay anything until October, and there's no penalty in the meantime, no interest, nothing changes for them, just a regular garden variety deferment.
A lot of good news for a lot of people out there who desperately need the money. Jason, thank you so much for that.
For the past couple of weeks, many churches have been streaming online to avoid crowded pews. But now that there are stay-at-home orders in place, we wondered what that means for pastors and church staff who are making all of that possible.
Our reporter Ken Lemon is in Gaston County, where a stay-at-home order went into effect there in the past few minutes. And Ken, what have you learned?
A spokesman for the county said the county changed regulations on crowd size. Before, they barred gatherings of crowds of 50 or more, but as of a few minutes ago, that's changed to 10 or more. Now, that will complicate things for churches like Destiny Church here in Gastonia. Last Sunday, they had a drive-in service here. The parking lot was packed with people sitting in their cars listening to the pastor. That shouldn't be an issue when they repeat that process on Sunday. The issue will be for live broadcasts of services at a church this large. You're looking at their service broadcast live here last night on Facebook. You can have 5 people in a choir, a band, and then staff required to work audio and video. The pastor said it will be a challenge adhering to those changes that went into effect just minutes ago, but he says they will meet those regulations.
Make sure that our team and our staff and the people of Destiny Church remain safe. We definitely don't want to be the cause of someone to become sick or ill.
The pastor says following the stay-at-home order ultimately means saving lives. He said restrictions can last a while, but in this case, he says it is best to follow the lead of health and medical officials. Back to you.
Again, thanks a lot. And Cabarrus County also told us churches and other faith organizations are allowed to live stream as long as there are fewer than 10 people on site and they are social distancing. Another note here, Mecklenburg County did not get back with us with specifics. Now, we did notice that North Carolina's new stay-at-home order that starts Monday does specifically list churches as essential.